is a great treasure. It is the highest blessing. It is the source of all happiness. Good health contributes to the emotional well being and happiness of a person. Even with limited income, a person with sound health can lead a happy and enjoyable life. It is said that the wealth of a nation depends on the health of its people, or the health of the people determines the wealth of the nation. With a healthy nation, consequently, there is a healthy workforce. This equates to more production and productivity, and most of all, people enjoy a better standard of living. In this week's episode of Guyana 411, for the next 25 minutes or more, we will examine budget policies, programs, infrastructure, and the future plans devised for improved healthcare delivery in Guyana. I am your host, Renetta LaFleur. Do stay tuned. Thank you for staying with us. Government has invested significant sums of money into the public health sector with the aim of improving overall health care and bridging the gap between the coastland and the hinterland communities. For the year 2016, the Ministry of Public Health has implemented a number of programs strengthening and developing policies to better healthcare delivery.
To provide a good level of health care, there must be proper infrastructure. Budgetary allocations were spent on the general upgrades of several facilities, along with a number of areas that hold the government's attention. However, the Ministry of Public Health spent budgeted allocations on the development of programs that are of great importance: maternal and child health, combating non-communicable diseases, suicide, the threat of H1N1 bird flu, and the viruses, along with managing health drug procurement.
The APNU AFC government would have committed 28 billion Guyana dollars, an equivalent of 10.9% of the national budget, toward the development of the health sector. The delivery of primary health care remains our fundamental strategic approach by this government in realizing the health agenda, as seen as our overarching approach to healthcare provision in Guyana.
Maternal and child health is top priority for the Public Health Ministry. This includes reducing infant morbidity and mortality and eliminating the chances of maternal death.
The budget has to reflect the program, okay? We are looking at maternal, infantile health, or the maternal and child health area. We're looking in that area. We want to see a obstetrician gynecologist in probably all the regions, okay, in all the regional hospitals, so that the high-risk cases can be diagnosed and the necessary measures taken.
Combating suicide, non-communicable diseases, and Zika has seen robust efforts being made towards ensuring that initial conditions that result in these threats are eliminated.
The Chronic Disease Department is currently embarking on a national survey for chronic disease risk factors. We call it the STEP survey. And this data will provide the information necessary to target at-risk populations. Early and timely intervention will significantly reduce morbidity and mortality, thereby resulting in a healthier population. The Ministry of Public Health has developed an action plan for Zika and pregnancy, an action plan. So for Zika and pregnancy, yes, an action plan for Zika and pregnancy.
Earlier this year, President David Granger, voicing his concerns on the alarming suicide rate, said much more needs to be done. He had called an emergency meeting with various ministries to ensure that all of the factors related to suicide are identified and addressed. An emergency suicide prevention plan of action was developed after a commission of inquiry was held into reasons for persons committing suicides. A psychiatry program is being developed for the University of Guyana, and this year a mental health secretariat was established to offer training and services to both professionals and those seeking mental health services.
Suicide continues to scourge our society. The Ministry of Public Health, with direct orders from the President, His Excellency Brigadier David Granger, has established the Mental Health Unit. The Mental Health Unit utilizes the Mental Health Action Plan 2015-2020 and the Suicide Prevention Plan 2015-2020 as a guide to address this very alarming issue.
The government has been providing free drugs and other supplies to patients. Budgetary allocations for consumable drug and medical supply procurement stood at $6.5 billion for 2016. This amount was to address the expanding range of services and coverage being given to citizens across our country. There have been challenges in 2016 in relation to the management of drugs and medical supplies. However, the ministry has been emphasizing compliance from regional health officers for timely submission of requisitions.
The availability of drugs at our health facilities continues to be a challenge. We have heard that financial expenditure, wastage, irrational use, and appropriate reporting via the cribs are some of the major factors that impact the accessibility of drugs.
With new programs being developed for the health sector, it is important to ensure that facilities are available to accommodate persons, departments, and equipment. A total of $1.9 billion was set aside for health facilities upgrades. With this amount, a number of capital projects had been earmarked in the ministry's 2016 budget for implementation and for the completion of others.
We have some funding, right, to take care of the maternity unit at Diamond Hospital. So maybe sometime before the year is finished or early within the next year, Diamond Hospital will be accommodating patients on an inpatient basis to deal with our maternity cases.
The $700 million Port Kaituma Hospital, which is currently under construction, is scheduled for a year-end completion date. In addition to the region having a new facility, the ministry will also provide specialist staff. The new facility will contribute to the development of hinterland health care in Regions 1, 7, 8, and 9 by providing adequate health services to all patients, thereby reducing the number of referrals to coastland hospitals.
Only recently visited there, and we keep on being on the ground there, trying to not necessarily rush things, but to make certain that when that hospital is being handed over, it will be what we'll be getting value for money. We're hoping that before the year is out, and they would have said something like October, but I would say just before the year is out, that everything should be completed there.
The Georgetown Public Hospital Corporation, the GPHC, is the primary health care facility in the country. The sum of $89 million was identified for the new maternity unit. This year's allocation facilitated the purchase of equipment including tabletop fetal heart rate monitors, handheld fetal heart rate monitors, and portable ultrasound machines. This is towards increasing the quality of service being offered at the hospital's maternal and child care facility.
Presently, we are in the process of occupying the extension of the maternity building. The operating theater is in operation. One of the rooms are. We are presently in the process of moving the NICU over. So within the next 2 weeks, we'll be occupying the entire top floor of this building, which will include the birthing room, the NICU, operating room, recovery room.
The upgrading of public health institutions in the rural and hinterland areas is aimed at reducing the congestion at the GPHC. The sum of $1.5 billion was allocated as capital expenditure to complete a health center at Experiment, Part Settlement, Region 5, where $32 million was spent under the previous government, and the Yarong Health Center in Region 8, which remains incomplete. This is even after $29 million was spent on that building. Additionally, over $1 billion will be spent on the purchase and maintenance of medical equipment.
With large sums of money allocated to the health sector, the management of such resource is key to ensuring quality health service. In fulfilling one of its mandates, the ministry was successful at ensuring that the deployment of specialist doctors and other healthcare professionals within the fiscal year. It also ensured that drug distribution system was continually monitored to guarantee that every person can access quality health care.
Citizens experience increased access to healthcare through qualified medical professionals as the number of physicians per 10,000 population increased from 14.1% to 20.3% in the first half of 2016. Additionally, the number of nurses deployed grew during this period. It has been emphasized by the government ever since assuming office that the training of its healthcare professionals will remain a priority under the Ministry of Public Health. Minister Cummings points out that although infrastructure is in place, if there are no specialists, then there will be no efficient delivery of health care.
We do have health centers and a few health posts. As you would recall, we have 5 levels of healthcare delivery, from the health posts to the health centers to the district hospitals to the regional and then to the referral hospital. And so we'll continue our supervisory visits both at the coastland and the hinterland. Going back to the hinterland, we also have medical evacuation services. Even though we would have treat patients and so forth, but there are some surgeries that we have to either send in a team or we have to evacuate in cases of emergencies. Even though it's a lot of cost to the taxpayers and to our budget, but we have to do it if we want to save lives. But I guess in the near future, we're planning to send more specialists to those areas.
The ministry's regional health service is geared towards making sure that all regional hospitals, including Bartica, Mabruma, and Lethem, are staffed with requisite specialists.
You can expect a higher level of care being given to the citizens in Bartica, because since the doctors can have their continuing medical education right within the region, well, then it means to say that there will be improvement in skills, and all of that will help in the upgrade of the health services being delivered in Bartica. There will also be an orthopedic surgeon, and there's also an anesthesiologist. Now, Region 9 already has the support staff to work in the theater there, right? So one of the things that we would need to do, because since at this moment we do not have an obstetrician and a gynecologist for Region 9, we're going to have a gynecologist from between Region 5 and Region 6 to rotate in Region 9 in the interim until we have a gynecologist and obstetrician earmarked for Region 9, right? But currently I must tell you that Region 9 has everything, all the potentials for a regional hospital, and that will be completed when all of the specialists would have taken up their position there.
Meanwhile, health centers and health posts would have more qualified staff as community health workers and staff nurses are exposed to continuous training to enable them to better able provide patients with quality health care.
The ministry is currently doing training for CHWs, and when that training is completed, of course, we're going to be sending in some CHWs to fill the gap in those health posts that are currently available, right? Because we would want all health posts as well as health centers to be staffed as adequately as possible, because remember, you have healthcare providers at the most basic level of healthcare, then persons are going to have access to healthcare in the sense that there is someone there to meet them when they go to the particular healthcare facility.
In terms of managing resources within each region, the Public Health Ministry has recognized that healthcare is not prioritized under the governance of the neighborhood and regional democratic councils. Distribution of drugs, management of finances, hiring of support staff, among other key responsibilities, are not met in a timely and efficient manner by the RDCs. Therefore, there is consideration for the re-establishment of regional health authorities, RHAs.
Because of the poor collaboration, that is why we would have proposed regional health authorities. In fact, between June and July of this year, 2016, a team from the Ministry of Health was sent on a study tour to Trinidad and Tobago, Jamaica, and Belize. And why we were sent there was to examine how their regional health authorities operate and to look at best practice for Guyana. And if I'm to summarize it, I would say to you that it's not that their regional health authorities is functioning at 100%, but what we would have discovered was that if we in Guyana, our healthcare system move towards regional health authorities, it means to say it will remove the Ministry of Communities from holding the finance for health. Because what we know is that sometimes, there's a delay in us doing certain things because Ministry of Health does not hold the purse.
The establishment of the regional health authorities will allow the ministry to address the needs of regions directly and with better management of resources. With the ministry having first-hand control of regional health services, the improvement of the healthcare system in Guyana is guaranteed. Specific focus will be placed on the needs of each region with direct response from the Ministry of Public Health. The ministry has submitted its proposals to be presented to Cabinet for the re-establishment of the regional health authorities in all 10 regions.
Our return to Guyana, the team would have compiled a report and we would have presented it to the National Policy Meeting at the Ministry of Public Health. And this information is supposed to be tabled or examined at cabinet level, and then a decision is going to be made to say if we're going to go that way in terms of having Guyana developing regional health authorities. Now, this will not be the first for Guyana because if you can remember, we had regional health authorities in Region 6, between Region 5 and Region 6, I must say. Right? And there were some good things about regional health authority within those two regions, right, that we probably might need to explore the way forward.
Taking all of these things into consideration, the Ministry of Public Health continues to make strides towards ensuring that the administrative aspect of healthcare is effective. Specialty services will continue to expand with the deployment of an obstetrician, gynecologist, and pediatrician to each region by the end of 2016.
Without proper infrastructure, there would not be efficient delivery of healthcare services. Therefore, a number of health facilities have been upgraded during the year 2016. Health posts, health centers, and hospitals have received new additions. Others that were started under the previous administration have received substantial allocations for their completion.
The government approved a number of capital estimates for hinterland and the coastal regions to develop infrastructure and facilities, providing safe, conducive environments under the Public Health Ministry's mandate. Some estimates covered projects which were incomplete, whilst others were meant for intensified programs and policy awareness.
We definitely would want to complete that which we came and found and for some reason or the other was being left behind, and we'd want to complete those projects and programs.
The hinterland regions 1, 7, 8, and 9 have seen major infrastructure completion, furnishing of theatres, living quarters for doctors, and other amenities that would create health environments of higher standards. Region 1 is one area which has recorded the most infrastructural development, with some projects scheduled to be completed by the end of 2016.
We are on the verge of completing the infrastructure of a hospital in Port Kaituma, and we hope that by in the early 2017, that hospital will be fully furnished and staffed, and we'll be able to provide a better healthcare service to Region 1 in general and Port Kaituma in particular.
In 2016, we basically would have awarded most of our capital estimate projects, except for the incinerator, which we are now working with regional engineers at the level of MOPH in order to develop a system whereby we can have the adequate persons to construct. It's a total of 26 million in total, and we expect to roll out both of that project, one in Mabruma and one in Pikira. Those are the areas that need it the most. We're trying to improve on facility infrastructure with the construction of Doctors Quarter, Warmuri Doctors Quarter, Manwaran Doctors Quarter, Prebano, and Barmito.
Region 7's district hospital at Partica was recently recognized as a regional hospital and has been upgraded to accommodate this new status. The hospital is now self-sufficient, showing decreased number of persons being referred to the Georgetown Public Hospital Corporation, and it serves as the major referral hub for Region 7.
The operating theater was refurbished, and all I can tell you is that we are doing all types of surgery now in Bartica, from general surgery to obstetrics and gynecology, and also ear, nose, and throat. I'm glad to say that in 2015 we had 18 surgeries done. Only for this year up to now, since the arrival of the surgeons, we have been able to do over 93 cases. Other than that, the ultrasound machine, which was not operational, is now working. So our community is receiving free ultrasound tests ordered by the medical specialist. The dental services have improved. A new dental chair has been bought to be installed soon. The river ambulance, a new ambulance, the boat is being constructed. It should be finished by the end of the year.
Region 8 has also benefited from improved health care as the ministry works towards continually bridging gaps in health care between the hinterland and coastal regions. Also included in the 2016 budget were funds to complete unfinished structures which were inherited from the previous administration. A portion of the 1.5 billion allocated for the completion of abandoned projects captured the Yarong Health Center at Mountain Fort, Region 8, which remains incomplete even after $29 million was spent on that building.
One of the things about Region 8 is that Region 8, the hospital that is being earmarked to be a regional hospital, it needs a theater, right? And that theater, I think for next year, the Ministry of Health will be focusing on the construction of a theater there for Region 8. Now, Region 8 is an area whereby we would have been doing a number of supervisory visits, and we would have been identifying the deficits within the area, right? And we would have been speaking to persons concerning how we're going to bridge the gap between both areas, hinterland and coastland areas. But remember, doctors would have been placed at various health centers in Region 8.
Region 9 continues to make strides in providing health care for residents in that region and even those who live on the Guyana-Brazil border.
I must tell you that Region 9 has everything, all the potentials for a regional hospital, and that will be completed when all of the specialists would have taken up their position there. Now, in Region 9, there was also a problem with the equipment. We would have taken in a Beckham culture, right, which is a machine that does hematology, right, or blood samples. And we would have also taken in a number of reagents to be used in Region 9, like glucose strips, easy lights, which is to test the electrolytes. And another thing that has been promised to Region 9, it's a biochemistry machine, which will soon be taken to Region 9.
Meanwhile, coastland regions have also recorded development, with Region 6 boasting of its continued infrastructure works being carried out at the New Amsterdam healthcare facilities and the construction of a new health center at Maro, which is said to have been neglected for some time.
Some of the capital projects that were included is the construction of a 14-bed HDU, which is presently under construction. There's also a phase 3 of the outpatient department, OPD3. This would include laboratory services and so on. Also on-call facility for doctors are working. We are constructing at the moment a health center on the east bank of Barbados at Mara. We have upgraded and added new facilities for doctors and nurses, that is in living quarters. And our current works is ongoing.
Upgrades and infrastructural works in other regions continue. The old Linden Hospital Complex building, the L8C, is being refurbished and upgraded to accommodate new additions. Infrastructural and rehabilitative works are being done under the ministry's capital projects. The building will facilitate consultation rooms, a 10-bed surgical ward, and a patient's waiting room at an estimated cost of some $20 million. There is also the ongoing construction of a solid waste furnace, a project that carries a cost of $13.5 million. The upgrading of public health institutions in all areas is aimed at reducing the congestion at the Georgetown Public Hospital Corporation and providing equity health services both on the coastland and in the hinterland.
With steady progress recorded for the past year, the government is planning to further enhance health facilities and healthcare delivery in 2017. Programs that have been implemented in 2016 are expected to bear fruits in the new year, while others are making way for the continued development of the sector.
There are visions and plans that have been presented by both health ministers that have been factored into the 2017 annual budget. These will take into consideration effective communication, reliable data and health information systems, program strengthening, and extensive infrastructure works being continued. This is to ensure that the physical, social, and mental health status of all Guyanese is improved.
I would like to see, or we would like to see in the Ministry of Public Health, computerized and interlink database system. We would also want to see evidence-based practices. Guyana is data rich, but I want to say we might be information poor. And so we definitely want to ensure that whatever we say, it's backed up by evidence. And so we want to work on that. We want to implement effective telemedicine. As you know, Guyana is so vast. We have 10 regions, especially regions 1, 7, 8, and 9. And even though you would have sent medical personnel to those areas, so we want to ensure that they have good communication system, cell phones, and so forth, so we can, in case they would have had any encounter difficulties, they can, relate with their seniors so they can have correct diagnosis being made, etc. We want to improve or step up our use of multidisciplinary team approach in medical services. So you don't want to have it ad hoc. You want to work with X-ray technicians. You want to work with environmental health unit. You want to work with all the players in medical, in this sector. So we don't want it to be isolated, but we're working on a team approach with all the different disciplines in the ministry.
Towards achieving these goals, Permanent Secretary Trevor Thomas says that there is need for stronger, more organized regional structures. This, he says, will better allow the ministry to manage the systems regionally, whilst at the same time increasing its capacity and ability to provide reliable data and information pertaining to the health sector.
If we're going to make decisions, if we're going to manage, then we must have built in our region the capacity to provide data that will inform decision making. So I'm optimistic that come 2017, the current structure for health in the region, if in fact there is a structure, and I'm not aware that the Regional Health Department in any region has an organizational structure, but if you don't, I expect in 2017 that each region will have an organizational structure. And this is something I've targeted myself to achieve with your support, so that we may not be able to fill all the positions in 2017. But clearly, regional health services cannot operate with the RHO and basically nobody else.
The Maternal and Child Health Department, MCHD, of the ministry remains one of the top priorities for the sector, as it is believed that a healthy lifestyle starts at this age. The aim of the MCH program is to ensure that women and children, wherever the family, obtain maximum health care which is necessary for growth and personal development.
We will move towards the improvement on the maternal and child health. And in child health, we would want to continue with the work that we've been doing in the vaccination program. It's a program that we haven't been doing too bad, but we want to improve on it and to incorporate new vaccine, particularly the human papillomavirus vaccine, which was introduced some time ago, but it was not successful because of the method that was used. We are learning from our mistakes, and we are involving the Ministry of Education along with us to educate and to inform not only the persons who will receive these vaccines, but the society in general.
Mental health cannot be overstated since it is linked to the high rates of suicide. For 2017 and onwards, emphasis will be placed on creating support groups and health environments for persons diagnosed with mental illnesses. Public awareness on factors that lead to mental illnesses will also be catered for.
My second priority that I did mention when I took office was my interest in mental health. And it is not only because of the high suicide rate that we have, where Guyana is claimed to be have the highest rate in the world, but because I think for some reason or the other, particularly in our infrastructure, mental health has been neglected. And that stigma that is attached to mental health remains the same way for some time now. Our approach is to eventually, after a gradual period, get rid of the use of a mental health hospital or a psychiatric hospital. We will be concentrating much more on what is referred to as a psychosocial rehabilitation center, where persons will be managed much more on an ambulatory basis rather than being hospitalized or institutionalized.
Improving the public health care system in Guyana is one of the government's main concerns. The Ministry of Public Health is resolutely committed to promoting healthy lifestyles and creating awareness on preventative measures by promoting lifestyle changes which have been shown to significantly reduce morbidity and mortality rates for most chronic diseases. Significant strides have been made in increasing life expectancy rates and reducing some of the common killers associated with child and maternal mortality. Major progress has been made on reducing malaria, tuberculosis, polio, and the spread of HIV/AIDS. The Ministry of Public Health is resolutely committed to the delivery of the best quality, equitable health care to all of the persons living in Guyana.
That has brought us to the end of Guyana 411 for this week. Do join us again next week for another edition of Guyana 411. Remember, this and all other GINA programs can be viewed on our YouTube channel. You can also get updates from our Facebook page. I am Renette LaFleur. Have a great week ahead. Goodbye.